Our VA Angelica recently ran a poll on our YouTube community page and asked, what would you like to know about adhesion? And the most common question that people had was, how do you get rid of adhesion ourselves because you're in New Jersey and you're too far away from us? So I'm going to do the best I can to answer this question for you. First, if you have adhesion and you have really complex pain and it's been there for a while, unfortunately, there is no good answer besides you need to see an adhesion release methods provider. Even myself, who has chronic pain throughout my body, when different areas are bad, I can't treat these things myself on me because it requires too much force and too much leverage. And I go to St. Louis at Precision Health Group every other month to get treatment by my mentors to keep myself well. Now, if you have hand, forearms, elbows, knee, shin, Achilles, plantar foot symptoms, then the grit bar, which is an instrument that you can get at gritbar.co, is something that can potentially be helpful, with the understanding that you should only have mild symptoms and expect to only get the superficial layers of adhesion. For example, if you have a deep nerve entrapment in your forearm or a deep nerve entrapment in your foot, the grit bar is not going to be able to access it because it only gets about a half an inch to an inch of depth of adhesion. It's not going to get anything that's really deep. So that's with those types of injuries. Now, what can you do if you just have chronic pain? You know you're having an adhesion problem, or you don't know you're having an adhesion problem, but you want to reduce your symptoms. Understand that all pain that you may be experiencing is caused by load exceeding capacity on a specific tissue, meaning you're putting too much physical stress on it, whether it's your normal everyday life activities or some fitness endeavor, whatever. So you can try to rest and see if that minimizes your symptoms, or you can try to do things that don't put excessive stress on that area of your body. For example, let's say that you have neck pain and you sit at a computer a lot. Now, do you always sit forward, reaching your head towards the computer, away from the back of your seat? Well, if that's true, then you simply sitting back is going to reduce the stress on your neck by 50 to 66%, which is an enormous amount. We call this the sit, slide, lean rule. You sit your butt down, you slide your butt back, and you lean against the back of the chair. It minimizes load on the entire spine by 50 to 66%, which is a lot. So that's one simple example. Or let's say that you have low back pain and you sit all day. You might want to take breaks every 30 minutes and just walk around, because that's going to put less stress on your spine and also give you an opportunity to relax and get some blood flow in there. So you can also try strengthening. The younger you are and the smaller or less complex your pain is, the more likely that chiropractic adjustments, physical therapy, acupuncture, dry needles, cupping, any of the conventional physical interventions is going to work for you. And there's also a reason why at Barefoot Rehab or almost any adhesion release methods provider, we're going to recommend that you see at least 3 other doctors or therapists to attempt to get fixed. And the reason why we do that is because typically we're more expensive, but also those interventions or treatments may work for you so that you don't need to see an adhesion release methods provider and spend more money trying to fix your problem. So you should try those things and see if you can get better. Like I said before, if those don't work, you try load management. You see if you can minimize your stress. If you have a forearm, hand, elbow, shin, knee, foot issue, you can try the grip bar. And then there are some massage therapists or chiros or PTs who claim to be able to fix adhesion, and you could also try seeing them. It won't be the same as an adhesion release methods provider. I used to refer a lot to active release technique providers until our patients would travel, go see an ART provider, and come back to us and say, Chris, it's not the same. That's because the adhesion release method system is much more succinct and precise and is meant and designed to fix people in chronic pain when it's been over 6 months and seen at least 3 other doctors or therapists without relief. Unfortunately, I do not have a good answer for you if you can't find an adhesion release methods provider near you, but you can try the grip bar, you can try strengthening and other conventional tactics, you can try load management. But hopefully, right now you can find a provider at www.findanadhesionprovider.com, and know that we are working very hard to get more doctors and therapists in our system who want to get better treatment outcomes, who want to fix people in chronic pain and get them spread throughout the United States and all over the world. So we're working hard on it. If you know a chiropractor, physical therapist, massage therapist who really cares about getting better treatment outcomes and fixing people in chronic pain, please send them our way, because we're looking for providers who want to become the premium doctor or therapist in their state or country. I'm sorry I don't have a better answer. Maybe technology or innovation will come up with a way that you can treat adhesions at home. But like I said, I'm not even in a place where I can treat my own adhesions outside of using the grip bar or the radial shockwave, which obviously for you, $10,000 to $20,000 isn't going to be something that you may want to do. It'd be easier for you to travel. I hope this is helpful. Again, I'm sorry I don't have a better answer, but with time, we're going to get more adhesion providers spread throughout the country and the world.